Okay, so we're going to show you how to add a clinical note. Along the taskbar, you're going to go over towards the right-hand side and hover over, and it says clinical note. You're going to hit the clinical note, and it's going to generate this screen. And then we always go over to the far left and hit add new clinical note, and make sure your date and time is okay, and you're going to hit okay. And then you're going to go to your Insert Date and Time tab and hit that, and it will automatically insert it. Then once you're there, whatever procedures that you guys did that day, you can go through and look at the list of treatments that are there. If they just came in for an emergency, you can also just click in this field and type everything that the doctor discussed with the patient. And you always make sure that you sign your full name and you put the name of the doctor as well. But let's say today we did a crown and that it's an original restoration. So we're going to double click on that. We're going to choose which tooth that we did the crown on. Let's say that it's tooth number 3. And you click OK. And then you're going to put the reason why. And these ones are kind of basic. Root canal or core buildup. Sometimes they're like this one, a large amalgam filling with recurring decay, or a large composite filling with recurring decay. If you click on any of these, they usually want a couple more things just to make it more specific, but we'll go through and add that at the very end. The note template wants to know if they used nitrous or not, and if they didn't, you can just leave it or delete it once you get into the very end and put that they didn't use any. But you just push OK, and then you're going to put how they got them numb. So you're going to add that they did benzocaine, which is just topical, and then the area that they put it in. So if you don't know where and the doctor did it or the hygienist did it, you need to ask them. Normally with this, if it's a number 3, they're going to do a buccal and possibly a lingual. And then you hit OK and choose whichever anesthetic that they used. If it's not in there, you need to add it once the note is complete. So we, in our office, use Articaine most of the time. We're going to put Articaine, we're going to put 2 carpiols. And if there's extra given during the procedure, you can add it here and what type it was. If not, then you just hit OK for not applicable. And then you do that again. If there's a buildup required, if it's other, then you can add in whatever you use if whatever the doctor uses is not here. So we're just going to put that there was none. Some of our templates haven't said anything right now, so we can go fill these in a minute. And then you're going to choose which type of crown the doctor wanted you to do. So whether it's full gold, a PFM, an EMAX, or a Bruxer, or a variation of that. And this is normally what the shade that we chose. So let's just say we did B1. And it's important to put those in. It's good to refer back to for any of the other crowns that this patient will be doing here. And then you choose which lab. So we're going to choose Evodent. And you're just going to put in there which temporary cement was used. So these are pretty easy. You just kind of follow along and hit OK. If you have any non-standard post-op instructions, you can put them here. And then you're always going to put if they scheduled a return appointment or no. So you can put that and what their next visit would be. You'd put in here. So we're just going to put crown seat or the abbreviations for crown seat. And then you always enter in your full name, no initials. And see, this even put it in the wrong place. So we're going to put our treating dentist as Dr. Jensen, and our next visit we're going to put up here as a crown seat. You can add in any post-op instructions, and even like in our office we use Bruxer Illusion. So I'm going to put in here Illusion because our template didn't let us do that. And then you can also add things like the gingival retraction, took impression for lab, If you took a bite registration, this is where you would add that. And any other changes that you need to make. We were talking about this, that we would add it at the very end that the tooth needs a crown because it has a large amalgam filling with recurring decay. I would usually add in there more specifics. I would put the surfaces like mesial, occlusal, distal, recurring decay. If there was any cracks or fractures, that information should go in there as well. And then you just hit Save Clinical Note. And you can just exit out. And that is how you add a clinical note.